Hi, I'm Dr. Joel Cohen at About Skin Dermatology and Aesthetics, a world's leading clinic. When it comes to Botox and Dysport and those types of agents that we inject into areas where there's muscle that creates lines, like in between the eyebrows and the crow's feet, there's a lot of misperceptions and a lot of myths get perpetuated. I wrote one of the largest textbooks on Botox and the other neuromodulator products. One of the things that I like to show people is, there's a picture of my wife. This is before and after. As people get older, we still want them to look natural. My wife always says she doesn't want to look like she's married to an aesthetic dermatologist. So at 53 years old, I want to make sure that she has natural looking movement. I do a lot of heavy laser resurfacing for people who have etched lines and wrinkles, like around the mouth and around the eyes. And one of the things that I cover in the textbook is some of the data about treating an area that we've resurfaced with Botox or Dysport in order to make sure that these muscles are not contracting during the healing process and recapitulating lines in the exact same spot. So that has data to show that we can actually decrease the re-imprinting of these lines in the same spot by using these injections. I do a lot of facial contouring, so we can use Botox or Dysport to inject the masseter muscle, which is this big muscle on the jawline. And sometimes people have a really, really hyperfunctional masseter. They might grind their teeth at night. And if we use these injections to slim down the muscle, a lot of times that changes the shape of the face to a more heart-shaped face. So we have some great examples of that. And a lot of times we actually take the focal point away from the area of the square jawline to really accentuating some areas on the lips as well, and very naturally preserving architecture and placing the filler in just the right areas and still allowing a little shape to it. We can augment the lips as well. A lot of times patients come in and they say that their sister or their best friend had a particular treatment. And it's important to point out that people have different anatomy, people have different needs. If we're treating neuromodulators, we might use a dose on one patient that we use a different dose on another, or we might be trying to accentuate somebody's cheekbones in one patient and jawline in another patient. So we really tailor the treatments to what the patient is looking for and what the patient really needs to look natural. A lot of times we'll use different treatments in combination, and they can be synergistic. So when I'm doing heavy resurfacing in somebody who has really significant lines here, I not only want to treat the lines effectively with the laser, but I want to use Botox or Dysport to decrease the mechanical contraction of that muscle underneath from re-imprinting the lines, A, during the healing process, and B, hopefully long-term, so that they don't recapitulate the lines in exactly the same spot. So when it comes to picking out your aesthetic treatments, I always say it's best to schedule a consultation, see what really the right tool is for the job. Sometimes people come in thinking they want one treatment, like injections of Botox, and it turns out that they would be better served doing laser resurfacing. Very often, treatments can be done in combination and they make the results of each one of them better. But overall, we need to really pay attention and listen to our patients, and natural results is what they're looking for. And we want them to look good for themselves, good for their age, and feel better about themselves. So to learn more about your treatment options, visit worldsleadingclinics.com.